Hi, I'm Dr. Manoj Padman, a senior consultant and head of department pediatric orthopedics at Fortis Hospital in Gurgaon. I deal with children's bones, and therefore it is critical for me to comment upon adolescent and teenage bone health. This has a significant impact into the bone health in adulthood, because one has to think about bone as a bank wherein you deposit calcium and essential nutrients during your adolescent and teenage years, so that when you reach adulthood, the natural tendency for bone to lose calcium, that is withdrawal from the bank, is offset. More than 25% of the bone stock is built up during the rapid growth phase of the adolescence, and by the age of 20 years 90% of bone stock is built up. So it is critical that correct lifestyle choices are undertaken during this phase, so that your stocks are adequately built up. And the key things are nutrition, the right nutrition, right amount of physical activities including exercises, and lifestyle choices. When a child makes a transition into the teens and the adolescent, automatically a lot of autonomy comes in terms of choice. Unlike a child who a parent can feed the right diet, once a girl or a boy reaches the adolescent, they get the autonomy to choose their diet, and therefore automatically it's well known that the dietary intake of calcium comes down during that phase. Studies have shown that 9 out of 10 girls in America have inadequate intake of calcium during the adolescent years, and probably about 7 out of 10 boys have the same problem as well. And this is because of autonomy, the amount of choices that they have, and they tend to make the wrong choices. And secondly, there is substantial peer influence during those years, which again can have a negative impact on bone health. And right or wrong awareness of one's own body image also contributes to this by propagating the wrong eating habits and inadequate intake. So it's critical that bone health is adequately looked after during those years, so that your stocks in the deposit, in the bone deposit, is built up, so that as an adult, when you go through the natural evolution of losing calcium from the bone and leading to osteoporosis, you have built up your bone stock sufficiently enough so that you don't get osteoporosis at a premature age, or even probably never at all. Therefore, this is a critical phase in every child's growth and development. During the teenage years, the critical thing is nutrition, adequate amount of calcium intake. Automatically a child needs much more calcium intake when they hit the teens compared to below 10 years of age. They need almost about 1,300 milligrams of calcium per day, which is probably about 3.5 glasses of milk. So that amount of milk plus milk products to get that adequate intake of calcium. The alternatives to milk and milk products are green leafy vegetables, spinach, broccoli, but they do not have the same amount of calcium as milk. So milk and milk products remain the number one source, but there needs to be a step up from what is the usual or adequate intake before the age of 10. The second thing would be exercises and physical activity, and this would include even simple things like running, team sports, any amount of regular physical activity. that would be the next key thing. Exercise automatically can be combined with exposure to sunlight, which would take care of your vitamin D requirements. One needs about 600 international units. And so if you have some activity which is outdoor and there is an element of exposure to the sun, the vitamin D intake is taken care of. The lastly, and the key, one of the last but not the least rather, is lifestyle choices. So, you know, aerated beverages decrease the calcium absorption. So as you go into the teens and when you are exposed to the various aerated beverages, carbonated drinks, exposure to caffeine, smoking and alcohol, these are known to kind of increase the incidence of calcium deficiency. So these are the three key areas which a child, when they hit the adolescence or parents of teenagers and adolescents, need to focus on.